We started off talking about some of the work that you have done in supporting not only the colleagues that you have back in Cameroon, but also the patients that they take care of through the telemedicine. I know that you shared that with me at some point, and I was fascinated. I wonder whether you can speak to that in terms of, how you actually do that.
Yeah. So again, this is another tool that physicians. It was it just came along, and I think it's telemedicine took off after the COVID pandemic. We realized how what a great tool it was to be able to deliver healthcare without being physically present. And for those practicing medicine on the continent, it is a way of actually getting subspecialty care without a subspecialist physically present. I wish when I was in the Central Hospital in Yaoundé in those days, I had access to a telemedicine nephrologist anywhere in the world, someone who could just tell me, well, for this particular patient, do this, do that, give me feedback, let's work together to improve and save these patients' lives. So that is now readily available. And for those colleagues that are willing, it is a very, very great tool. We work as a team. They say when you have several heads together trying to solve a problem, you are more likely to succeed than one person doing it all alone. And because there are things you may underlook or overlook, but overall is delivering good quality care to our patients. So I've had, a lot of colleagues reach out to me with difficult cases, difficult medical situations to handle. And, then we work together and, bounce ideas over each other, and the way forward, get the treatment plan, and then look at the patient's response, and so on and so forth. So I have been able to actually, help a lot of patients who were almost on dialysis end up recovering and going home, and they have saved themselves and their families a ton. But the physicians have to be able to reach out. They have right now, prior to this time, there was a difficulty in connecting with those physicians practicing in the diaspora in other area, in other countries outside Africa. But now with social media, you can now, have a face-to-face discussion with a colleague back home in any corner of Africa over a case that he may be seeing and handling. So that has helped a lot, and I hope this area of medicine is also exploited for the benefit of our people.